where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or someone curious about taking a more natural approach to your health, you're in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
I'm definitely drinking tea today.
Welcome, Janet Madrid, to our show today. So Janet is an author, speaker, and founder of Hope for Health, Integrative Oral Health and Wellness, a mobile dental hygiene practice dedicated to advancing whole body health through a functional, prevention-focused approach. As an oral systemic health educator and valued member of the integrated healthcare team, Janet champions the integration of medicine and dentistry as the gold standard of care. With a deep passion for medical dental collaboration, she empowers individuals to take charge of their well-being by cultivating curiosity, embracing education, and recognizing the body's innate ability to heal. Through her work, Janet is committed to education, equipping, encouraging, and empowering the public understand and apply the foundations of health and wellness, ultimately improving the health outcomes and generating true hope for health.
Awesome, Janet. Janet and I met at Under One Roof a couple years ago. So I had the pleasure of getting a little bit of a sight of her van. But Janet, tell us a little bit about yourself and your background and what drew you into dental hygiene, and walk us through your journey as it's evolved into functional and holistic dentistry.
Okay. First of all, I want to thank you ladies for having me on your show. And I love the name Functional Roots. I'm surprised no one has chosen that name before because it's genius. But what is my dental journey? First of all, I have been in for 46 years in dentistry. I was a young dental assistant at 16, learning on the job with my neighbor who was a dentist. And I started out just doing sterilization, setting up rooms, turning over rooms, no gloves, no masks, hands in the cold sterile. Also, actually touching mercury every single day in my hands, raw, with nothing on, not knowing that it was toxic. And when I was 20, I was a dental assistant, then I got certified as a dental assistant, then I went and got my ETA, and when I was about 20, 21, somewhere in there, all of a sudden, overnight, boom, my liver failed. Nobody knew why. I was young, I didn't do drugs, I didn't take medications, I didn't drink. They thought maybe it was hepatitis. They did all the hepatitis tests, nothing. So they basically sent me home and said, either you're going to get well or you're going to be on the liver transplant list. And so I was in bed. I could not lift my head. I couldn't get up to go to the bathroom by myself. Nobody knew what it was. I was just like knocking at death's door, if you will. But thankfully, our livers are able to regenerate. And I spontaneously healed, not spontaneously, I would say it was like a 2 to 3 week time period where all of a sudden I got better and better, and I've never had another problem with my liver. But I've been very careful. I had been sick, like getting a cold or something. It was Christmas Eve. I think it was 1983. And so I had taken some Tylenol. Tylenol is the worst thing to take for your liver. And I never take medications or anything. So ever since then, I was like, okay, I don't like alcohol anyway, but I'm not going to drink. I'm going to not take any medications. I'm going to take care of my liver for the rest of my life because I don't know what happened. Anyway, when I was a dental assistant, I really wanted to go to dental school. I fell in love with dentistry. I wanted to go to dental school. Then I got married, had kids. Dental school was out the window. Then fast forward to a 12-year-old, 8-year-old, 4-year-old, and 2-year-old, and me going through a divorce, leaving Hawaii, packing suitcases, moving to Colorado, signing up for hygiene school. And so as a single mom, I went through hygiene school. I was in my 30s. I was the oldest one in the class, but I had all this experience with dentistry. And so I actually ended up being like the class mom. I had my own 4 kids, but then I had all these youngsters too to help tutor and everything. And I happened to graduate first in my class. I was very dedicated because I had to pay my way through school with scholarships and so forth. So my GPA had to be really up there. But I went to hygiene school and single mom. I worked like crazy 5 days a week for many years. And then COVID happened. And when the dental offices closed, I was like, this is really stupid. And I had started being actually in 2009, I had thought, I knew I could go independent in Colorado. And I was thinking about it, but I wanted to have Hope for Health Wellness Center, like that had everything, that had the diet and the exercise class and the functional docs and everything in one place, like counseling and just classes for cooking healthy and teaching people how to grow their own food and the whole thing. That's what my dream was. Then I ended up meeting my current husband, and that went out the window. Even though I registered my business name, I had no idea how I would finance it or anything. But anyway, so that was like back in 2009. And then I was really focusing more on the oral systemic connection, and we need to be doing more for our patients. I never was one to recommend alcohol mouthwashes. We always had the little Listerine samples, and I never gave them away because it was like, first of all, I didn't know about nitric oxide at that time, but I knew that alcohol is a risk factor for oral cancer. And I'm like, why would we be having people rinse with this strong burning alcohol stuff? So I never recommended it. And I even had patients that when they asked me what's the best toothpaste, I would say, you don't need toothpaste. You just need to have good hygiene. You need to be flossing well. Your technique has to be there. I'm like, I don't care what toothpaste you use. Yeah, I was never like really a big pusher of any of the stuff. And then SLS, I was sensitive to SLS and I stopped using that a long time ago. Anyway, so I was going through with a lot of people. I started doing like eating for your blood type.
Okay.
And then I had a patient that came in with gout. And I'm like, what's your blood type? And we're talking. He's bloody. He's a mess. Just like perio maintenance that was just not good at all. Elderly gentleman. And I said, if you're blood type O, and I'm like, tell me what your diet is. He goes, I'm a farmer and blah, blah, blah. And I said, do you eat pork? He said, I have a pig farm. He said, I eat ham or bacon for breakfast and ham sandwich for lunch and pork chops for dinner. And I'm just like, you're not supposed to be having pork. And so I told him about this book. 3 months later, he came in walking, no more gout problems, no more, he had a little bit of inflammation, but nothing like he did before. And I started like really delving into giving patients more on the oral systemic connection than normally we do. And then in 2019, DeWitt Wilkerson came to Rocky Mountain Dental Convention, and he did a really good class and talked about his book, The Shift. I don't know if you've heard of it, but he made me just say, this is crazy. We have to do better. We have to get into the whole airway and everything. And so I started trying to talk to the dentist that I was working for about it. And they're like, that's not our area. We're just focusing on the teeth, the mouth. That's our area. And I'm just like, ugh. 3 months later, the pandemic happened. Dental offices shut down. I started doing all kinds of CEs. I went to the oral health. I did the oral health summit on virtually. I joined AOSH. I joined IAOMT, IABDM. I was like watching all this stuff, doing all these CEs and getting my mind blown. And then I said, I'm just going to start my own practice. And I bought mobile equipment, but then I thought, I can't carry this stuff around. So then I bought a van and I just jumped right into it. I said, that's it, I'm done. And I found out through the Oral Health Summit that it was mercury toxicity that killed my liver. And I'm just like, that's it. I'm not going back now. I'm just jumping in. I'm going full speed ahead with this. And I just, thankfully, my husband agreed to support my wanting to get in debt. And so, yeah, he believed in my dream to do it. And it's a dream because I'm able to spend as much time as I want with my patients. I'm able to spend an hour on their medical history if I want to. And I spend at least 2 hours per patient, like with a new patient, sometimes longer, sometimes if they're because I usually see 2 patients a day. If they're my last patient of the day, sometimes it'll go longer. And I'm like, yeah, why don't we continue this conversation when your saliva test comes back? Yeah, so I'm just able to do all the things. And the beauty of it is there's still so much to learn. And I don't have an ozone generator. There's some things that I want to do that I'm not able to do because of space and because of the investment and the equipment and stuff. But there's so much more still that I can do. And it's just really exciting. After 46 years, I'm more passionate about dentistry now than ever before because we can make an impact on our patients. And it's just mind-boggling how, with a little bit of education, they are ready and eager for change, and they're informed and they're hearing about these, and that's what they're looking for. They don't want the status quo anymore. Anyway.
Awesome.
That was a long-winded answer.
It's perfect.
But that's been my journey, 46 years, and I just absolutely don't want to quit. My husband keeps saying, when are you going to retire? And I'm like,
when are you going to stop taking classes? Can you focus on one thing, please? That's what
Yeah.
I got to go take this class. And
I know I've got so many courses that it's sometimes online courses that are at your own pace are dangerous because you can get signed up for too many and you can't be doing them all at the same time. So I'm like, okay, I'm going to focus on getting this one done and then I'll do that one and then I'll do that one.
Yes.
But everything is so interesting. I want to do it all.
That's winning at your career, right? When you have something that is so mentally engaging and physically engaging, but even something that just gives you, gosh, what so many people want. And that's just that gratification. You're helping people, but you're just engaged in every aspect of it. And then what we're trying to do is find that community of hygienists, of those biological providers that are just doing things differently, but are so engaged and passionate in what they do that you don't want to retire. Why would you want to retire? You're at the top of your game. You're getting so much out of it now.
That's why I don't understand the whole burnout thing, because if anyone should be burned out, it should be me. But I'm far from being burned out. I feel like there's still so much to learn, and I'm so eager to help patients. I have a patient that I'm going to be seeing on Thursday that is a 14-year-old boy that has been on a ventilator, tracheotomy ventilator, since he was born. And he's blind, and he's been in a nursing facility for a long time, but he just got adopted by a family that they're taking care of him at their home and everything. And they're like, we don't know when the last time he went to the dentist or anything. And he's being he's NPO, but you still will grow oral bacteria.
And it's harder build up when you're not chewing and doing that is insane.
And people don't think that. And I'm just like, I cannot wait to help this family and show them how to take care of his mouth and see. I haven't seen him yet, but I can imagine what it's going to be like. And I'm just really so excited about it because we have so much that we can help with, all the ideas and all this forum that you have. I love listening to your podcast and others because I'm learning more things every single time. I'm like, oh, I didn't know that. I need to look into that. And I remember this one patient that maybe that could help them or whatever. It's like you're always like firing and thinking and, like you said, engaged. One of the quotes in my book, the very last quote. Let me see, I'll have to read it. Vincent van Gogh said, "Your profession is not what brings home your weekly paycheck. Your profession is what you're put here on earth to do, with such passion and such intensity that it becomes spiritual in calling."
I love it.
It's a calling. It really is. Like you have to really love it. And it saddens me because I do temp and because I like to be out there and spreading the message. I like to get into office and see what they're doing and say, "Hey, have you guys thought about doing salivary testing? Or do you have laser? And why don't you guys consider hydroxyapatite?" Anyway, I like to go in and try to encourage and raise the level of care in that office. And it just really saddens me when I can hear hygienists in the next room that aren't even engaging with their patients at all. And they're doing the patient is in and out of the chair, exam prophy
And
and
that's
and
where the
bite
burnout
wings
comes.
in like 30 minutes.
Exactly.
And I'm just like, wow, 1 hour is not enough time for me to
Mhm.
get to help this patient. And it's like there's so much opportunity there. It's like, why are they in that kind of a rut? So this is great. You guys, I hope people will listen to your podcast and read my book and get reignited their passion and get engaged with their patients and just be a lifelong learner, basically.
Yeah, I'm hoping that we pass that passion. I know Amanda and I joined because of the same passion for just teaching and talking to other people about the differences that there are in dentistry. And there's even just a difference in the groups that you talked about, right? Like the AHOSH group and the IAOMT, IABDM, holistic dentistry. Like those are 4 different buckets of functional dentistry in general and different philosophies that carry in between, and then understanding what bucket you might fit into, right? I'm working with a functional doctor and we're trying to struggling a little bit with finding a functional doctor, and we're needing someone in the IAOMT, like understanding consequences of root canals and amalgam fillings and where that systemic ties into health for like you, where that amalgam exposure and mercury severely impacts. And I think that's where most dentists start that same transition like you did. I'm surprised it took you so long into dentistry to realize that it was the mercury toxicity. Was such a
Thankfully,
problem.
because I don't think it was widely known and I was in the box of conventional doing the thing. And then once I got into hygiene, I didn't have the exposure that I did
Yeah.
before, which was thank God. Because if I had still been suctioning all that amalgam and still polishing amalgam fillings and breathing those vapors, I probably wouldn't be here to tell about it.
Yep.
And nobody would have known. And yeah, these things are, but as far as fitting into a bucket, you brought up the bucket thing, but it's like, how do you put the ocean in a bucket? Cannot. And so I am of the philosophy that there's not a perfect right way,
Mhm.
that there is multiple, and that's the whole puzzle of a patient and getting to the functional root of the problem. It is because you have to do a really deep dive. I talk about in my book about that going to hygiene school is really hard, but what really is hard is once you get out into practice and you have to consider the patient's immune system, their environment, the all the different things that happen to get this patient where they are. And then what do they call that when you deconstruct and try to figure out and go back and figure out where did this come from? And it's just like lots of interview, lots of listening to them. And a lot of patients that I have been to, they're like on their last hope of, because they've gone to dentists, their mouth is a mess, they're phobic, they've had dentists tell them, oh, it's going to cost, you're going to have to lose all these teeth, we're going to put implants and you're going to get it's going to be like $60,000 or whatever. And they're just like shell shocked. They're even worse. They are hopeless because they don't have the money. And then they somehow find me, and I'm like, let's clean your foundation up. Let's make things healthy. And then let's see where we go from there. And what's the first priority? And what is we have to listen to the patient. They come in and we just want to tell them all this and, oh, okay, sign on the dotted line and hand over your checkbook kind of thing. But these patients, they are just like so thankful for the time that I spend with them. And you're taking baby steps. You're trying to win their trust. You're helping them overall. And they are just so thankful. And it's gratifying. And it just feels like I'm making a difference, one person at a time. And it's really great.
Thank you for sharing just all of the impacts that you get to have in your unique clinical setting. So would you mind sharing, like, how do you go about integrating functional or holistic concepts into your model? Are there tools, your diagnostic? You mentioned salivary testing and some other things, but what does your model look like?
Every patient, so on my website, I list everything that comes in a new patient visit, and I list the cost. And I discuss that with my patients up front. And it's not like they can cherry pick and say, I want to do this or I want to do that. It's this is the way I am going to best serve you. And you can partner with me or you don't have to. It's fine. There's a lot of other practitioners out there who will just do a prophy. But anyway, so the first thing I do is salivary testing. I'm using the Bristle Health test right now pretty exclusively because of the vast amount of information that you get from it. And I do have patients that are coming in with their chief concern is halitosis, or their chief concern is they just get a cavity every time they go to the dentist, or they have in their medical history, they talk about they have gut issues. And so it's not just gum inflammation. It's not just periopathogens that we need to be looking at. We need to be looking at the whole picture. First of all, I do a very thorough medical history and I just try to get their whole story and I listen to their story. Sometimes they'll talk to me for 20 minutes before we even get to me asking questions. I do all their vitals. I check their temperature, check their oxygen saturation, their blood pressure, and I collect their saliva and I also do a nitrate level of their saliva test. And I also do a pH. And so we talk about those issues and I explain why I'm taking this, what it means, what are the importance. I give them brochures. We talk about it. I ask them questions. Have you had this? Have you had that? We go through all of that. If they have gut issues and they want to, they can order through a company I work with, Microbiome Labs, they can order a stool test to be sent to their home and they will send it to the company. The company will do the test and then I will have a consultation with a functional expert and they will make recommendations and they will evaluate the test and give recommendations to the patient. And then I give that information to the patient. And so I work with people on their gut issues as well. When I work with laser. I am not doing currently, I want to be doing some inflammatory blood work, which I can do with Rupa Health. I just haven't quite implemented it yet. There's just so many things that we can do, and it's like a lot. And I'm already doing a lot. Once I diagnose them clinically with what I'm seeing, and then I tell them, okay, today, everyone pretty much that hasn't been seen in a year or so, they're going to have some inflammation. So I automatically, a 4346 is included with my first appointment. And then if it's a true pro fee, then I will bump the fee down to a pro fee. But most of the time it's going to be scaling with inflammation. And then if they're showing clinical signs of periodontal disease, radiographic bone loss, bleeding, then I'll say, let's see what your test results come back with. And then we're going to talk, and then we will further go to the next step of your treatment. A lot of my patients have functional doctors. They work with acupuncturists, they work with chiropractors. And so the way that I work with them is usually emailing, or sometimes the patient just wants the information and they'll say, okay, give me a copy of that so I can show it to my functional doctor or to my primary care. I also send patients for myofunctional therapy because I screen for that. For evaluation of their swallow patterns, whatever, tongue tie, tether oral tissues, those kind of things. I also screen for airway. I send them to various airway focused dentists. I recommend them to get a sleep if they don't want to do that. And I say you need to talk to your primary care about that, or I can send a letter and they'll say, oh yeah, I'll just talk to my doctor about it because they've been saying they wanted me to take a test. And I'm like, this is what I see in your mouth that indicates that I agree. And I explain to them how important knowing if they have some type of sleep disorder, breathing going on. And so that's how I do it. It's very different with each person depending on what type of primary care they go to, what kind of dentist they have. Because some of my patients have a biological dentist of record, but they do their hygiene with me.
Okay.
And then if they have something, I take their routine x-rays. And if they have a problem, I'll forward their x-rays, the intraoral photos. I'll say, this looks like there's caries, blah, 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 whatever. Sometimes I'll refer to a specialist. It just depends on what the patient is looking for. Some want to use their dental insurance. So I have a few that somebody will be like, I can't afford to get safe mercury removal done, and I just need to get this cavity fixed or whatever, or this filling is broken. And so I give them the option, explain to them the benefits and everything, and then I direct them to some options that I trust that I've worked with before. And because not everybody is going to be in the market, but our job is to educate them, and then they can make their own choice of what they want to do. Because if we've done a good job of educating them, then, they will make the choice based on their beliefs, their budget, the urgency, whatever the case may be. But we're there to advocate and support them in whatever decision they make. I just go along the journey with them. And they call me, text me, come sit at my dining room table. We go over, this treatment plan, and this doctor gave me this treatment plan, and what do I do? And I'm just like their advocate, the liaison. And I'm like, here's this and here's this. And I explained to them better than what they would have had when they went to their appointment. They're like, I don't understand any of this stuff. Why is this and why is this different? And so because of my extensive dental experience in dentistry, I'm able to, which I think that's an advantage when you come from dental assisting into dental hygiene, because you can explain treatment to patient.
Yeah.
Whereas when you come out of hygiene school, a lot of times you don't know that. And I've seen it all. And so I have a lot of experience and ability to explain things to patients to where they can understand it and make an educated decision, make an informed decision.
Awesome. Are the doctors that you're working with, like the functional doctors and even the dentists, pretty open-minded with communicating with you?
Oh, absolutely. I have dentists that I have 3 biological dentists that I work with, and I've worked for them before, but sometimes they'll send patients directly to me when they see that patient isn't really lining up for because they do a lot of full mouth reconstruction, really big cases. And if that patient is looking for holistic, but they're not really up for doing like the whole mouth and the bite restoration and all that kind of stuff, bite rejuvenation or whatever, then they'll send them to me, and little by little, I'll get them to a point where either they're going to get restored with just their caries or whatever other work they need. And then eventually they might go back to that dentist once they start finding out that really, because it's a hard pill to swallow when you go in for the first time and someone tells you you need $60,000
Mhm.
worth of work. I couldn't do it.
Yeah. No.
So they need baby steps, but they also need to get a foundation of a healthy homeostasis in their mouth where their oral microbiome is healthy and they're not at such a high risk for caries and all that kind of stuff. So I get their foundation going, and then they slowly start going to see some other practitioners that might be able to help them with other restorative needs.
Awesome. And Amanda, it was really cool because Janet came in from Bristol and she had done her own test and she had this beautiful oral microbiome test that she had done. And then she was like, and I just wanted to tweak something. So she took an over the counter rinse and then she tested and came back and she was like, I blew out my oral microbiome with the rinse I tried.
Rx. Woo!
She was like, okay, so this is what happens when you have a fairly good oral microbiome and then you use an over-the-counter rinse, and we won't mention what rinse that was.
Yeah.
But and she completely wiped out like some of the good stuff. And I was like, yep, this is what happens.
Yeah.
It's typical. And it's like
I have
it was
another test that I'm waiting for
beneficial.
my results now that I've gotten everything back, and I've been using the Protectin, and so I'm like, okay, everything should be really good now.
What are some of the top products that you like to recommend for your patients? Since you are heavily into the oral microbiome, like I am, what things are you finding are working for helping to shift? And I know what things don't work, obviously. I'm going to be using Listerine and not a big TheraBreath person in that perspective. But what are some of the tools that you're finding helping to shift your patient's oral microbiome?
So oral probiotics, my favorite now is Bristle Health because they have the 6 strains that are that a lot of the high risk oral pathogens are sensitive to. I recommend the Bristle oral probiotic, and also I'm getting people on Protectin now, which I'm really loving that, and a good nanohydroxyapatite toothpaste, either Fig or Boca or Dr. Jen, just depending on what they're looking for. Those are the main things because less is more. I am a big, huge, old school focus on flossing with string and brushing correctly. And so Dr. Tongue Brush, Cure Prox, love the single, it's like an end tufted brush and you trace along your gum line.
PS009.
Yes.
It's my favorite.
Yes, the 1006 or 1009. I have the 1006 for myself, but any patients that have longer teeth or more embrasure space or root exposure, then I do the 1009. But I'm just loving those Cure Prox brushes. And funny thing is, I always used to think they were too expensive, so I never recommended them. And then when I went to the class and I saw under the photon microscope how frayed the bristles are of like your over-the-counter toothbrushes, I'm like, oh my gosh, this is crazy. It lasts forever. And now it's like I'm always, and my grandson said to me yesterday, I said, are you using your little single toothbrush around your gum line? And he looks at me and he goes, they're squeaky clean. He goes, yeah. He goes, I'm always licking my teeth because they're so smooth. And I said, yeah, you never feel plaque on your teeth with that thing. I'm obsessed. I do it when I'm watching TV at night. I just don't going around.
I keep one I have 3 of them, but one always travels with me, one in my office, one in my purse.
Yeah. And I show them to my patients too, especially if I'm going, obviously in my practice, I pass them out and I show them touch to teach. I show them with their own brush. But when I go temp, I'm not going to be taking toothbrushes to another office with my resources. So I take my own and I have it in my pocket. And then I'll pull it out and I'll go, you can get it from Amazon or cureprox.com. And then I show them, I'm like, see, this is how I do it, and go around. And yeah. And people, I'm surprised at how many people have never been shown a mirror to see their own plaque on their teeth. And they're like, oh, did you brush this morning? Yeah. Did you? Yeah, I use an electric toothbrush. Oh, okay. So then I show them the mirror and I'm like, see right here down along the gum line. And they're like, oh, they're like, wow, I'm really missing down there. I'm like, yeah, you are. And that this is why, because when you put a toothbrush like this, when you got roots that are longer, it's going to miss the whole thing down there. So anyway, we just have to be showing our patients more home care. When you have a 70-year-old that no one's ever shown them how to brush their teeth and they go to the dentist
Or
every
floss,
6
cold
months
floss.
or floss, I'm just like, seriously, we have to do better. I don't understand. It's just,
it blows my mind.
it's
sometimes.
elementary.
If you hand someone a piece of string and you're like, oh,
Uh-huh.
show me where you have food, and they're like,
Yeah.
like, let's
Or it's
just
like,
show you how to do
or
it
it's like
right
this, they're
way.
holding it like this far apart and they're like,
Yeah. They, and that's where I worked for a dentist. They're like, oh, you need to floss more. You need to floss more. They're probably flossing. They just haven't been doing it because they were never
yeah,
shown
they don't
how
know.
to
They don't
do it
know. Yeah.
appropriately.
And also the other thing I'd like to recommend, because people like to use irrigators. I don't call them water flossers because I want them to floss and then irrigate afterwards. But I like the Viajet from Oratech,
Yes.
the ozone irrigator. And so I recommend that one. And as far as electric toothbrushes, I'm switching to Prox. I used to really like Sonicare a lot, but I
Those
like
were
the
words I never thought I would say. Oh, I'm not just a Sonicare girl. If I did not have that Curaprox one, I would have never switched.
Yeah, and
It's
I just
phenomenal.
I like
And
the
it has the
smaller
end toothbrush.
Yes. I love that. And the head is smaller, and people really, some of the toothbrushes that we give out or we used to give out were just too honking big, and they don't contour with when you've got a root surface up here and one down here and one up here. One of those normal toothbrushes is not going to work. You have to focus on each individual tooth. Oh, yeah, we need to just be teaching people how to brush and floss and give them a mirror, show them, let them hold it. I had one lady that was in her 70s, and she wasn't very mobile. She was in a walker. Had a lot of edema. And I started talking to her and showing her, and she started crying. She goes, thank you so much. Nobody has ever shown me how to do that. And if you just show them, we try to make decisions for our patients without giving them the opportunity to choose and learn something. And we just assume that they're not going to do it. And it's telling someone to brush and floss is very down here. It's like, we're not doing a service at all when we say that.
And that's where that 2 hours is really helpful. I too, at my biologic practice, had an hour and a half with patients. And sometimes I cringe when I see like other people, at 30 minutes, they barely had to do anything on my teeth. I'm like, they're not really doing a good job if they're just spending 30 minutes in your mouth, because it takes me 20 minutes to do health history, sometimes a half hour to just go through health history information and figure that out, do your oral cancer screening, and then
and just
protein.
And do OHI and show them where they're missing and all of that, and perio chart. And it's like when I finally get to pick up my ultrasonic and my hand instruments, it's like an hour and 15 to 20 minutes into the appointment, because I've been covering all the things, and we've been reviewing, how's this going? How's that going? What did your doctor say about this? There's always a conversation to have. And it's not, oh, yes, we talk about personal things sometimes, but a little bit, but that's not the gist of the conversation. I hear people like telling their whole life story about this movie and that. And that's not why you're here. They're here to learn about how to take care of their teeth better and their gums and their systemic health. It's just, yeah. I keep saying we can do better. We can do better.
We can. Yeah.
We touched on like burnout, and I think how there's quite a few hygienists that really aren't engaged. And I think partly that's because they're being put in a box. So many states don't have autonomy, or practices are just set up where a hygienist has to fit into a specific role that the practice needs. But I think a lot of that can lead to burnout and just disengagement in their practices. But I think on the opposite side of that, I think a lot of hygienists are really rethinking their roles, not just as hygienists, but as healthcare providers. I want to hear what you think the future of hygiene looks like, and how does that independence or that autonomy play a role?
I think that we should be like nurse practitioners and physician's assistants, because really our role is counter to dentistry. I have always told my patients, tongue in cheek, I'm trying to put my dentist out of business by making you not have cavities and not have to have this periodontal therapy again. And it would be great. And some of my patients, I see them once a year and they are pristine. I only need to see you as often as you want me to, because some people be like, oh, when was the last time you flossed your teeth? And they're like, oh, the last time you flossed them. And it's no. I need to teach you how to take care of your own, because you're the one who are cleaning your teeth, not me.
Yeah.
You are cleaning your teeth. And so I want my patients to know when they need me. And I don't want to like, okay, I want to have a butt in the chair every 3 months. That's not doing anything for me. I need a new person that doesn't know anything and get them equipped so that they're like, it's like how you do for your children. You raise them and boop, out of the nest you go. You don't want them coming back to do their laundry and coming back to, it's okay. That's how we are with our patients. We need to get them all equipped up to where they're on their own. And yeah, they need a professional cleaning, but everyone is different. Some people need it more often. Some people can go. I saw one lady that she hadn't had her teeth cleaned in 8 years, and her oral pathogen test came back optimal. Her bristle test came back optimal in every area.
Awesome.
Wow.
Every area was optimal. And I'm like, hey, I don't want you to stay away for 8 years, but come back and see me in a year, 18 months, whenever you feel like it. And when do they come back? 9 months later or something, because they want to see me. And
Yeah.
they're like engaged, and they're like, instead of, I hate going to the dentist, they're like, oh, I want to go see Janet. And it's more of a checking in kind of a thing. How am I doing? They want to prove to me that they're doing a great job. They want to show me, and they're like, okay, so how does it look? Am I doing everything right? What else can I do? And I'm like, you are doing perfect. You don't have to add anything. You're just doing great. And so that's what we need to do. We don't need to be making our patients dependent on us. And like how dentists will watch something until it gets bigger and bigger. We need to be on our own, because what we're doing is trying to prevent patients from being in the dental chair. And so it's counter purpose in a way. I know that's controversial. And a lot of eyebrows are going to be raised, and I'll get letters and emails, but we really are. We are prevention specialists, and dentists are tooth fixers.
Yeah.
They
It's
fix the
reactionary
problem.
versus preventive.
Exactly. I wrote an article for Crown Magazine about how we went from starting out in as a dental profession as reactionary, then foresight, introducing the profession of dental hygienist and being preventive, but it never really, the dentistry as a whole didn't become preventive. And so it's still been reactionary, and it's been very like shame based, shaming the patients. I started dentistry in 79. And it was wag your finger at the patient. Oh, you haven't been flossing. Oh my gosh, you are going to lose your teeth. If you don't start flossing, you are going to lose your teeth. Things like that, shaming the patient. And we need to change from that to being a hope generator, to giving positive reinforcement to our patients and generating hope and giving them understanding and giving them grace and showing them what's good about what they're doing and helping them, give them other things to where their whole life will improve, and connect the dots that we're not just concerned about your gums and your teeth, but we're concerned about your life and your health and your brain and your quality of life in the future. This is not just about making my job easier so I don't have to scrape so much. This is about your future and your health and giving them positive reinforcement. And I coined myself as a hope generator because that's what I believe that the dental professional's role is now, is to generate hope for our patients, particularly dental hygienists, because we are prevention specialists. But I wish dentists would get on board with that too, because patients, when they see that there's going to be improvement, because they're always afraid to come in and they're always saying they're sorry. I'm so sorry. I'm so sorry. I haven't been in a long time. And I'm sorry. I'm sorry. I'm like, you don't have anything to be sorry about. You're here now. And I'm happy that you're here and I'm here to help you. And you made a great choice. And that's in the past. We do the best we can until we know better. And then when we know better, we do better, Maya Angelou says. And so I think that we need to make that shift to being more positive and just giving our patients hope.
Awesome. I agree. I feel like even us hygienists too, like I have to remind them when we do the bristle test and maybe the score didn't change what you thought and we can compare. Okay, let's just start with the positives. There has been a great change. Like we just have like X, Y, and Z still hanging out and it's keeping our score from moving a little bit. But we've gotten rid of all of these other ones that are problematic too. So we need, I think, as practitioners to be able to point out those positives as well. And our patients do need to hear, like Amanda says it all the time, meet where your patient's at and make sure that they're encouraged and not you're ashamed on what they're doing.
Absolutely. Absolutely. And they, like, I always try to emphasize with my patients that, okay, your clinical appearance is great. You're doing everything you should. You don't have any bleeding. You still have some pathogens here, which is a risk factor, but you are keeping it under control with what you're doing. And so it's increasing your risk, but it's not a sentence saying that you're going to get heart disease or whatever, because all the things you're doing. And as in the world of functional health and holistic, it's not ever a really quick fix. And it's a journey, it's tweaking, it's trying this, it's trying that. And we just keep moving forward in the direction that the patient is responding to. And that host response, remember in hygiene school, the host response. That's why what integrative and functional and all that is that we have to look at the whole host. Like we learned that. It's the nutrition, their stress, their airway. There's so many factors, not just the brushing and flossing. There's other factors that affect their mouth, that affect their oral health. Because if their immune system is compromised, then they're not responding. Their immune system is not handling the amount of pathogens that they have. And so that's where we have to support them more in those areas, in boosting their immune system. And that's where, like the gut probiotics, there are certain spore-based gut probiotics that I use in conjunction with my scaling and root planing and things, Bacillus subtilis and a megaspore biotic that helps boost their immune system to help bring down these pathogens because they're circulating. And HU58, which is Bacillus subtilis, it makes antibiotics itself within the digestive system. And that's where 70 to 80% of our immune health is. And so everything is connected. And that's what I talk about in my book.
Yes.
About how everything is connected.
So
So what
speaking of,
inspired you?
yeah, there we go.
Yes. What inspired you to write your book? And what does hope mean when it comes to your patient healing and wellness process?
I think that hope is basically showing them that there can be a positive outcome, that there is a light at the end of the tunnel, that there is a pot of gold at the end of the rainbow or whatever. Giving them hope is just showing them that we're going to be on this journey with them to get to their goal of whatever it is. And that yes, we want to empower you to get better because we can help you get there. So that's giving someone hope. It's having expectation of a good outcome. And so without hope, if you're hopeless, there's not really much that you can do. That's where your life ceases to exist, is when you're hopeless. So we want to give patients hope. And the reason that I wrote the book, so I called my book Hope for Health because that's the name of my business. Hope for Health is just, I don't know. I've had my own health struggles and I'm on a journey myself and I haven't arrived. But through this journey of learning all these things and through dentistry and through my Christian beliefs and through my spiritual beliefs, I feel that there are certain foundational principles that fall in the holistic realm, that body, mind, and spirit. And so I wanted to write a resource book for my patients that covered things that I talked to them about and maybe some things that I forgot to tell them so that they can have resources and stuff. And it's basically, it's body, mind, and spirit. And it goes through things like breathe and hydrate and nourish. And then the last chapter talks about play and touch. And then we're talking about not only physically touching other people, because there's really good benefits to that, but also being in touch with yourself, being in touch with nature, the sun, the earth, grounding, all the things. And also connection, which is connection with each other, being in community, the tribe like we are. And also with like people that are lonely, they should go volunteer or go to the local rec center and do a swim class and meet people who are in some type of community. They live longer. And then connecting again, a lot of things overlap. So like connecting with the earth and connecting with God or your higher power, whatever it is. And so I touch on all these things. I go into all the things to look for, patients to look for, that getting back to the body. The section on breathing and nourishment and hydration are huge because I put key points at the end of the chapter after I talk about all the things, and I give some stories and I give bullet points as to here's what to look for. Are your teeth wearing down? Here's what you look for, which could indicate that you have sleep apnea or whatever, and for children and this and that. And so all of these things, so there's a lot of things to do with dentistry, oral systemic stuff, but there's also other things in the book. And it's a short read, it's a quick read, it's a reference book, and it's funny, and it's got some humor and some personal stories, and I think it's a really fun book. So oral health can be fun.
I think it's a blast.
Yeah, it is. It is a blast. It is a blast. I love it. I live for it. Every day there's not enough time to get everything done that you want. Yeah, so I just wanted to have a resource for my patients. And I always thought about it. And then last year when I went to RDH Evolution, I met Michelle Prince, and she was saying you should tell your story. And I had already started writing it, or I had like kind of an outline, but I don't know if I would have ever gotten it done without that little push. And there you have it. A year later, and it's out there on Amazon.
That's awesome.
Congratulations.
Find your posse, right? I
Mhm.
think Amanda and I connected that way too. I was like, this is what I want to do. And then
it is
find your people.
It is so cool. Yeah. And that's why I really enjoy going to like different conferences and things, and I'm going to the microbiome labs. It's a symposium in Nashville, and it's all about gut, and there's going to be mostly doctors there. I know a few dental offices that are going to be there because we all use that with our salivary testing and so forth. But mostly it's functional people, medical doctors. And so we're all collaborating and we're showing them, because one of the things that I want to do is I want to spread the message to the whole medical community about how you need to be looking at these things that I mention in my book with your patients. And when someone comes in with high blood pressure and they're 32 years old, you don't want to put them on blood pressure medication right away. Or if you do, if it's so high that you do, you should also be asking them, have they been to their dentist? Are you using mouthwash?
Do they have sleep apnea?
Do they have sleep apnea? If you don't know how to screen doctors, you can send them to us and we can screen them for sleep apnea. And then you can give them a test or whatever. But we need to be working together. And like women who are trying to get pregnant, they need to be having salivary testing. We need to find out, like, do you have the high risk pathogens for adverse pregnancy? Everyone, it shouldn't just be us that's doing salivary testing. First of all, we need to be in the whole medical. There shouldn't be such thing as
We have to put the
dental
on the body.
insurance. Yeah, it's okay. If I have an infection in my tooth, it's not just in my tooth, it's going throughout my whole body. So that's a medical thing. That's another fight. And we need to be getting patients to start fighting about it.
I feel like some of the functional doctors are starting to see that. I'm submitting for a co-class with Karen Pleinmel. We're going to be submitting to speak for functional medicine. It's a 45 minutes. I don't know how I'm going to do 45 minutes.
So yeah, I know we can't do 45 minutes with that interview.
Yeah, I don't know how 45 minutes is going to go, but we have a really cool case study with someone who we're doing salivary testing. We've got the gut zoomer test and some of the other tests that go along with it to show the oral systemic connection. And he's full of root canal failures and infection and Marcons. It's just like everything. And it's starting in the mouth. And she's we have to get this out. So I love that you're doing that. When is the microbiome?
That is September 17th, 18th, and 19th.
Okay.
I think. Yeah. So we'll be hearing from all the doctors and stuff. And actually one of my friends, they have some case studies that with their salivary testing and with their patients that have been on the probiotics, gut probiotics and stuff like that. And yeah, it's just, I feel like I'm just scratching the surface. Like it's the tip of the iceberg.
Yep.
There's so much more for me to learn. I am by far from the more you find out you don't know.
Yep.
Once you see it, you can't unsee it.
This is so true. This is so true. And it's so sad when you go in and you're telling this patient, this guy comes in and he looks like, do you remember the guy from the Mad comic? Yeah, small little chin, bucked out teeth, little tiny ears, like way back. And I'm asking him all these questions and stuff. And he's like in his 30s and he's a financial guy. And so I'm at a temp office and I'm talking to him about his airway and all these things and about expansion and about his tongue tie and his mouth breathing and all this stuff. And then the dentist comes in and he's all interested, right? And the dentist comes in and he's, hey, doctor, she's been telling me about this. What do you think? And he's, you're just you. That's just you. And I'm just like, I'm standing behind the doctor and my eyes are rolling back in my head. And I'm like, he said, yeah, you can go get braces if you want straighter teeth, but your teeth are pretty straight. They just have a little crowding down here. But like the whole airway concept right over his head. And I'm just like, this poor guy, he's young enough and he's not married. He doesn't have kids. He's got the finances for it. He could get fixed up and not have these health problems and sleep apnea in the future. And Lord knows what other kind of problems he's going to have. And he would be better looking too.
It's hard. Like the airway, I wish we were teaching more in hygiene school about airway. And yes, brushing is super important when it comes to little kids, but the airway, looking
it needs to
way
be
ahead of time is
it
so
needs
much
to be
more important.
Yes, these kids need to be screened when they're
4, 3.
Yeah, I think that they say a lot of the airway people say that if they don't start at 4 with expansion when they need it, that it's already not too late, but it's like
You're missing the boat already.
you're missing the boat already. Yeah.
Yep. Yep.
And we can see it. We can see it. I can see it in so many people. And a lot of times the parents will say, the pediatrician, and then the dentist will say, oh, it looks fine. It's not that bad. And then you're like dead in the water because you can't say anything else when the dentist is not on board with what you're talking about. So that's why I try to stick with the ones that are on board with the same page with me. And but I still, when I temp, I'm hopeful when I walk in that, oh, maybe some of my passion will rub off on them. Maybe some of the things that I'm talking to patients about, the doctor will say, hey, I've been hearing about that stuff. Like some of them, they mustn't do any CEs at all or something. I don't know how they don't know anything about Airway yet. Like they've been in dentistry for 30, 40 years and they haven't heard anything about it. It's crazy.
It's just taking the minimum amount of CEs needed to get licensure.
Yeah.
We have the overachievers like we are, or we'll have 60 CEs in a year.
Yeah, which after I
the
get
few
the
that are like,
minimum, I
oh,
hardly ever
I need
take
12
counts anymore.
CEs to get my license. Where do I find my CE?
Yeah, the
Those are
last
the
month.
ones that-
And the last month they're trying to get their CEs. And I'm like, I'm so far over. I don't even know. I don't keep count anymore. After I get over so many, I'm like, I just stick them in a file. I don't know how many I have. A ton.
Speaking of learning and CEs, as we start to wrap up our conversation with you, Janet, what is one thing that you're reading, one thing you're listening to, and one thing you're learning right now?
Okay. I just got the God Code, and my sister bought it for me because we were talking about it on a little road trip that we took to Wyoming the other day. And so I'm reading the God Code. I think that's going to be really cool. And I'm listening to all things. I'm like, what am I not listening to? I'm listening to, let's see, what was the latest thing I listened to? I've been listening to, have you guys heard of Dr. Shafali? So it's on conscious parenting and like reparenting yourself and how to be a conscious parent to where we're not trying to live our lives through our children. We're letting them live their lives and we're like helping them. Because I'm old school and we were like very authoritarian in our family. Okay, you do what I say. Children are to be seen and not heard and stuff like that. And that was like totally dysfunctional. And so now I'm like reading this stuff and listening to Dr. Shafali and trying to correct some of the things, even though my girls are grown. I think it's never too late to apologize to your kids for things that you didn't know any better. And they're great girls and we have great relationship and everything. But I still feel like it's necessary to acknowledge the mistakes that we've made once we know, oh man, I'm sorry I did that. I didn't realize that was not a good thing to do. And please forgive me. And they're like, Mom, we know you were doing the best that you could and blah, blah, blah. And thank you for acknowledging that. And it's so healing. So I'm listening to that, reading. Oh, and what am I learning? Right now, I'm doing a course about behavioral. It's called, what is it called? I can't think of what it's called now. Anyway, it's Eliza Kingsford and it's about brain power and it's about the neuroplasticity in our brain and how sometimes it's not our willpower for things, like it comes from a deeper level. And yeah, that's something I'm learning about. Nothing relating to teeth right now.
Yeah, that's interesting.
So it's
but
all
it's
like,
though, because it's the mind, body, spirit at the
yes,
same
it
time.
is.
Like, the
Exactly.
consciousness and in healing component.
Exactly, because our minds are very powerful. I talk about this in the book, is that really we create the reality. And a lot of our dis-ease is based in our past and things, traumas and different things. So there's so much to unpack in all these realms. And I definitely don't know everything about it. But I've dabbled in a lot of things. And so that way I can try to, if I am picking up on something that my patient is talking about, and I'm like, have you heard about this person? And maybe you should look into that, or it sounds like this, or whatever, because the more we know, the more we can help our patients and ourselves, because it starts with us. We have to physician heal thyself kind of thing, is that we're our first, we have to take care of ourselves so we can take care of others.
Absolutely. Stress and forgiveness and all of that plays a huge role in healing.
Absolutely. Absolutely.
Awesome. Janet, thank you so much for joining us today.
Well, thank you for having me. And you guys are both going to be in Texas?
We will be at Under One Roof.
And
Awesome.
we're going to be at the IAOMT booth, and we
Oh,
just got word that we are going to have a microscope at
How
the IAOMT
awesome.
booth. That's going to be shipped to my house so I can work on getting that set up. And we have some fun stickers that we are going to be handing out, and we're going to be talking about biologic hygiene at the
awesome.
booth. So Amanda and I, and then Kristen King is coming, and she's going to do some fun stuff with us. So we're going to try to do some more biologic activities and excite
Awesome.
hygienists to learn a little bit more about biologic hygiene at the booth.
Awesome. I will definitely go by and see you. And of course, I'm assuming Brian will be at there also.
No,
Bristol.
we're not. Yeah,
Bristol's not going to be there?
No,
What?
no. I know you call him and give him a hard time, but
Brian.
yeah, Bristol won't be there. Of course, I'm gonna have some stuff. I'm sure if we are showing anything, we have a monitor that I'm sure I'll be talking about Bristol while I'm there. But
Yeah. And I was talking to Mark Berhenny, and he was saying he's not going to be there either. He wrote the foreword to my book, and we just were emailing each other because he wants to interview me. And I said, because he had said he was going to be there, and then he said that something has come up and he's not going to be
Oh,
there. And
yeah.
wow, I'm so disappointed at both of them.
I know. This is the first one for the last 3 years that they're not going to be there. Yeah, but
Oh,
yep.
okay.
So, but it will be.
Well, there's going to be a lot more fun people there, so
There will be
there.
lots of fun
It will
people.
be a lot of fun.
Yeah. So let's
All right,
see.
you guys